So on to case 2 now. Here's the preoperative radiograph from the referring dentist showing the leaking coronal restoration. However, the dentist had prepped the tooth for a crown prior to me receiving the patient. The root filling in the MB root is short with patent root canal beyond it and a nice periapical radiolucency. The distobuccal and palatal root canals appear to be filled to length. However, there is a periapical radiolucency around the apex of the distobuccal root. And here we can trace the inferior border of the antrum. So here's the microscope view of the tooth isolated with rubber dam. It had been prepped for a temporary crown. I removed some of that restorative material with a long tapered diamond burr, and now we've got composite in the base, which I can remove using an ultrasonic StarTex 3 instrument. I'm now going to remove some of the filling material and any caries using a tungsten carbide LN burr. So to rapidly remove gutta perca from the coronal part of the root canal, I'm going to use a Gates Glidden number 1. These are very flexible instruments and have to be used quite gently, but because they're small, there's less risk of creating a ledge in the root canal. Can now use a rotary instrument, the ProTaper SX, to refine the coronal preparation. Irrigation, as always, with 3% sodium hypochlorite. I've located the orifice of the MB2 and I'm just starting to flare it as part of the preparation sequence. Here I'm using a reciprocating instrument, a reciproc size 25, to remove remaining gutta perca from the middle of the root canal. This instrument isn't going to the full working length because don't forget I haven't actually done an apex locator reading yet. Here I'm using an electronic apex locator to confirm all my working lengths to a reproducible reference point. Preparation was completed using a combination of Wave 1 Gold and Edge Endo 1 files. The micro opener is very useful for removing little tags of GP that are stuck to the walls of the canal. Irrigation in this case was carried out with 3% sodium hypochlorite, agitated with an Irrisafe ultrasonic tip. After ultrasonic agitation, I then used the endo activator with the same 3% sodium hypochlorite solution. After irrigation, I carried out my cone fit. The canals were all dried using matched sterile paper points. I wanted to take a cone fit radiograph, so to avoid the cones being displaced, I seared them off at the level of the pulp floor. The palatal root of this tooth was very long and it doesn't really show up clearly on my cone fit radiograph, and the cone also appears to be long. So I'm intending to take another radiograph of the cone fit so that I can just double check. Removing the cone is very simple. In this case, you just insert a headstrong file into it, and it will very easily be retrieved. I'm now continuing with vertical compaction in the buccal canals before refitting a cone in the palatal canal and then exposing a second cone fit radiograph. This is my second cone fit radiograph, and you can see that the buccal canals have all been obturated completely, and the cone in the palatal canal appears to be at the correct length now. There's a little bit of sealer beyond it from the previous cone fit. I can now complete obturation of the palatal canal. The referring practitioner wanted to place a post in here, and so I'm leaving post space so that he can restore the tooth the following day. A final check with the microscope shows the pulp floor and the post space in the palatal canal ready for the referring practitioner to restore the tooth. I'm using PTFE tape to seal the base of the pulp floor and that post hole, and then the restoration in this case as a temporary was a Compomer Fuji 9. So here we have the preoperative radiograph from the referring practitioner showing the short root filling in the MB root. And then here is my final radiograph showing the MB1 and MB2 superimposed in the mesiobuccal root, the palatal root canal with a small bead of sealer at the apex, and then the distobuccal root nicely compacted from the pulp floor to the